All right. Ever thrown your back out trying to open a pickle jar?
Yeah, me too. Back pain, it's practically universal, right?
Right.
But today, we're not talking about the everyday aches and pains. We're strapping in
Oh, yeah.
for a wild ride into the world of spinal trauma.
Yeah.
We're talking the kind of serious stuff that makes you instinctively grab your own neck just thinking about it. Car accidents, falls, you name it. And we've got a stack of sources here
We do.
that break down everything from how these injuries actually happen
Yes.
to the potential long-term consequences. So,
That's fascinating.
yeah,
Actually.
I bet.
Yeah.
And it's those potential consequences, I imagine,
Yes.
that make spinal trauma so different from just your everyday, sore back.
Absolutely. Because we're not just talking about discomfort here, but potential damage to the spinal cord, the information superhighway of your entire body.
And that's what makes this whole assumed spinal injury thing so crucial.
I agree.
Yeah.
Yeah.
Our source really emphasizes that first responders, that's like rule number one for them.
Absolutely.
But why is that assumption so important? I mean, it's not like every bump and bruise means you've got a spinal injury, right?
Well, you'd be surprised, actually.
Okay.
Think of it this way. Imagine if a major highway suddenly shut down.
Okay.
Traffic backs up, communication breaks down, everything grinds to a halt.
Right.
That's essentially what happens with a spinal cord injury.
Wow. Okay.
It's not just about the bones, it's about what those bones are protecting.
Okay. That's a visualization I won't soon forget. Speaking of which, the source got really detailed about the actual structure of the spine
Yes.
with all its different regions, the cervical, thoracic, lumbar, sacral. I mean, it's like a bone tower with its own zip code.
It's true.
And to be honest, it's a lot more complex than I ever imagined.
Right.
Why all the different sections? What's the deal with that?
It's all about function.
Oh, okay.
Each of those regions, your cervical, your thoracic, lumbar, sacral, coccygeus, each of those has its own unique job to do.
Right.
Which also means it can be injured in its own way. It's like how a sports car is built for speed and a pickup truck is built for hauling both vehicles, but very different vulnerabilities.
So the type of injury then depends on which part of the car gets hit, so to speak.
Exactly.
Which brings us to the how. And forgive the pun, but this is where it gets really spine-chilling. Our source calls this section mechanisms of injury. And it's basically a playbook for how these injuries actually happen. And let me tell you, some of this stuff is like watching an action movie gone wrong.
It is. It's about understanding the vulnerability that's hidden within that strength.
Okay.
So take axial loading, for example.
Okay.
Imagine a diver landing headfirst into a too shallow pool. That force compresses the vertebrae with such intensity that it can actually fracture them.
Ouch. Yeah. That's a hard one to imagine. It's amazing how something we see as, like, fun, can be so dangerous.
Exactly. Or think about whiplash.
Right.
That sudden jolt back and forth like in a rear-end collision, that's a recipe for severe extension and flexion of the neck, potentially damaging those delicate structures.
And those are just a couple of examples.
Right.
Our source also talks about rotation,
Yes.
like in a twisting sports injury,
Sure.
or penetrating trauma, which, sounds exactly as scary as it is.
It can be.
But you mentioned something earlier that really stuck with me, and that's the vulnerability of those C1 and C2 vertebrae. What makes those two so different? I mean, they're just at the top of the neck, right?
They are. But it's their location that makes them so crucial.
Okay.
They're literally holding up your head and protecting the brainstem,
Right.
the control center for, all your vital functions. Damage up there, it isn't just painful.
Right.
It can be instantly life-threatening.
Okay, now those are the kind of details that make you want to wear a helmet 24/7.
Right.
Really puts things in perspective.
It does.
Knowing how a seemingly minor injury in the wrong spot can have such a major impact.
Exactly.
Wow.
And those C1, C2 injuries are just one example of how devastating spinal cord damage could be.
Right?
So let's kind of delve into the different ways these injuries actually manifest.
Okay.
Because our source makes a distinction between complete and incomplete spinal cord injuries.
Okay.
And to be honest, those terms always sound a little clinical to me.
Right. Like, what does that actually look like for a person experiencing it?
Yeah.
Is it as simple as complete meaning total damage and incomplete meaning, like, things aren't so bad?
It's a good place to start, but the reality is far more nuanced.
Okay.
Think of it this way, with a complete injury.
Yeah.
It's like the communication line between your brain and the body below the injury is completely severed. No signals are getting through.
Wow.
But with an incomplete injury, it's more like some of those signals are still getting through,
Okay.
just in a jumbled or weakened state.
So instead of a clean break in the cable, it's more like some wires are frayed or crossed.
That's a great way to put it.
Okay.
And depending on which wires are affected, the symptoms can vary wildly.
Oh, interesting.
Our source goes into a bunch of these specific syndromes,
Okay.
and some of them are pretty mind-blowing.
Okay, well, lucky for me, you're basically a walking, talking neurology textbook, so hit me with it. What are some of these syndromes and what makes them so different?
Let's start with anterior cord syndrome.
Okay.
This one typically happens from a flexion injury.
Mm-hmm.
Imagine someone having a really bad fall and landing on their chin, compressing the front of their spinal cord.
Yeah, I can picture that, unfortunately.
So, because of how the spinal cord is structured,
Okay.
damage to that anterior part, or the front part, disrupts motor function.
Okay.
So movement
Mhm.
and things like pain and temperature sensation below the injury.
Wait, so you might not feel a hot stove or know where your legs are in space.
You got it.
Wow.
But here's the thing.
Okay.
Light touch and proprioception, which is basically your sense of body position,
Right.
might still be partially intact.
Interesting.
So someone with anterior cord syndrome might not be able to move their legs,
Right.
but they could still feel a gentle touch on their skin.
That is wild. So it's not as simple as everything below the injury being gone. It's way more specific than that.
Absolutely. And to make things even more fascinating,
Okay, lay it on me.
let's talk about Brown-Sequard syndrome.
Okay.
This one often results from penetrating trauma, like a stabbing,
Okay.
where only one side of the spinal cord is damaged.
Okay, so very different from the fall we were just talking about.
Right.
Got it.
And because of how nerve pathways cross over in the spinal cord,
Okay.
we see something called ipsilateral and contralateral effects.
All right, hold up. Those are some $10 words.
Chuckles.
Break it down for me.
Sorry. Ipsilateral just means same side.
Okay.
Contralateral means opposite side.
Okay.
So with Brown-Sequard, you might lose motor function on the same side as the injury,
Okay.
but lose pain and temperature sensation on the opposite side of your body.
Wait, so if you were unfortunate enough to touch that hot stove, you'd feel it in the hand that couldn't even move to pull away. Oh my God.
It's like the signals got their wires crossed in the most unfortunate way possible.
Wow.
It's one of the things that makes spinal cord injuries so complex to diagnose and treat.
I can only imagine.
Right.
Okay, so we've got these different ways an injury can happen.
Right.
And then all these variations in how the injury itself actually affects the body.
Yes.
It really drives home how this isn't a one-size-fits-all kind of thing.
You got every case is unique, which is why early diagnosis and a tailored treatment plan are absolutely critical.
Which brings us to, I guess, the what happens next phase.
Right.
Our source goes through this whole journey from the initial emergency response
Yes.
all the way to long-term rehab.
Right.
And let me tell you, some of that ER stuff sounds intense.
Yeah.
They mention this like log roll technique for moving someone with a suspected injury.
Mm-hmm.
It almost sounds like something out of a spy movie.
Right.
What's the deal with that?
It is, yeah. It's all about minimizing movement.
Right.
Like they're treating the spine like a fragile artifact.
Yeah, exactly.
One wrong move could cause more damage.
Right.
So the log roll, it's all about moving the patient as a single, rigid unit,
Oh, wow.
keeping their spine perfectly aligned.
Okay.
It's a delicate dance. It takes a whole team to pull it off safely.
Oh, I bet.
And that's just the beginning.
Right.
Imaging is crucial.
Mm-hmm.
X-rays, CT scans, MRIs, they're all tools to help us see the full picture of the injury.
It's like detective work, but for your spine.
There you go.
Speaking of detective work, I was really surprised by the sources section on high-dose steroids. They're often used in other types of trauma, but here it sounds like they're more of a controversial topic.
Yeah, and it really comes down to, you see, steroids, like methylprednisolone.
Right.
They can help reduce inflammation in the spinal cord after an injury,
Okay.
which in theory could limit further damage.
Right.
But there's a catch.
Okay, what's the catch?
Potential side effects.
Okay, so it's not just a simple, like, give everyone steroids situation.
Not at all.
Got it.
It's a delicate balance between potential benefits and risks.
Right.
We're talking increased chance of infections, gastrointestinal bleeding, even lung complications.
Wow.
The decision to use them is complex,
Yeah.
individualized, and still hotly debated in the medical community.
Wow. So it's not just about fixing the immediate injury, it's about making sure the cure isn't worse than the problem itself.
Exactly.
That's a tough one. But let's say that initial crisis is over.
Okay.
What comes next?
That's when the focus shifts to the long game.
Okay.
Rehabilitation.
Okay.
And we're not just talking about physical therapy here.
Right.
Although regaining strength and mobility, obviously a huge part of it. It's also about occupational therapy.
Okay.
Learning to adapt to daily tasks, reclaim independence.
So regaining that sense of autonomy.
Exactly.
And what about the psychological aspect of this? I mean, this isn't just a physical injury.
Right.
This is a life-altering event for a lot of people.
Absolutely. The psychological and emotional toll of a spinal cord injury can be immense.
Right.
So therapy, support groups, a strong support network.
Right.
These are all crucial. We're talking about helping people navigate a new reality, not just recover from a physical setback.
You know, reading through all of this, the thing that really got me was the section on pediatric spinal injuries.
Oh, okay.
They mentioned something called CPWARA, which it's an acronym, of course, because medicine loves those.
Of course.
It stands for spinal cord injury without radiographic abnormality.
There you go.
It sounds like a medical riddle to me.
It does, doesn't it? But it's a very real phenomenon.
Right.
And it highlights just how crucial a thorough evaluation is, especially in children.
Okay.
Basically, CPWARA means there's neurological damage to the spinal cord,
Okay.
but standard x-rays don't show any obvious fractures.
So a kid could be showing all the signs of a serious injury, but the x-ray comes back perfectly normal.
That's exactly it, and it's why we can't rely on imaging alone, especially in kids.
Right. Gosh, that's scary.
It is. A child's spine is still developing,
Right.
making it more flexible and unfortunately more prone to these types of injuries.
Of course.
That's why a high index of suspicion, a detailed neurological exam, and potentially an MRI are essential in these cases.
It really drives home that whole always assume spinal injury idea we talked about earlier.
Yes.
Better safe than sorry, especially when we're talking about a child's developing spine.
Absolutely. And it brings us to, I think, a larger question
Okay.
that I hope our listener will ponder even after this deep dive.
Okay, what's that?
Knowing how prevalent spinal cord injuries are, how complex the treatment and long-term impact can be,
Right.
how can we as a society improve?
Wow, that's the million-dollar question, isn't it? Where do we even begin?
It's multifaceted, right? Of course, research into new treatments
Right.
and hopefully a cure is crucial.
Of course.
But we also have to think about prevention
Right.
and advocating for better safety measures, from stricter seatbelt laws to safer equipment for sports.
Right.
And we can't forget about raising awareness.
Right.
The more people understand the very real risks associated with spinal trauma, the better we can protect ourselves and our loved ones.
It's a call to action for all of us, really, to be informed, to be proactive, and to be compassionate towards those living with these life-altering injuries.
Well said.
Well, on that note, I think we've given our listeners a lot to think about today. We've covered everything from the anatomy of the spine to the complexities of treatment, the emotional toll, and the importance of ongoing research and support.
It's been quite the journey. We really went deep on this one.
We did. We went deep. So to our listeners, we hope this deep dive has been informative and engaging, but also empowering.
Absolutely.
Knowledge is power, after all, especially when it comes to something as crucial as spinal health.
Could agree more.
Well, until next time, thanks for joining us for the deep dive.